Rehabbing injuries can be simple, but your plan has to be centered around two key factors, one being tissue specific and the other being patient or client specific. First, when we're talking about an injured muscle, whether it's a strain or tendon pain, we need to think about the loading profile of the exercise we're prescribing, how much force is being produced and through what range of motion. Let's use the adductor longus as an example, which is the most commonly injured groin muscle. During early stage rehab, we want low force and low stretch. The goal is to limit tendon compression as well as mechanical tension. Think supine ball squeeze or side-lying leg raises. During mid-stage, we'll introduce high force with low stretch. Copenhagen planks show very high EMG activity with the adductors, which actually makes them a very poor early-stage rehab exercise. Stage can also include some low-force and high-stretch exercises for some pain desensitization, where we can slightly nudge into painful ranges as long as we're not experiencing flare-ups. And lastly, the later stage, where pain has settled for the most part, will introduce high force and high stretch. This is where we can have a bit of fun. Weighted adductor flies, Cossack slides, and eccentric dragon squats to really load the tissue at length. Second is patient participation with respect to irritability. The main goal with rehab is seeing how we can maintain a client's fitness level without aggravating the injury. High irritability probably means they can't do any loaded adduction without pain, especially under hip flexion. Their main strength movement will probably be a narrow stance heel elevated squat. Moderate irritability means they can load that muscle through a partial range. This is where medium stance box squats fit in very nicely. And low irritability means they can tolerate full range, but they just have to be careful with load management. Here we might introduce full range back or front squats, sumo deadlift, or sumo squats. So realize not all groin injuries behave the same, and exercise selection will be highly dependent on the nature of the injury. But this is an easy plug-and-play strategy you can implement with some of your rehab clients while maintaining some form of loading on the damaged tissue depending on the stage, while challenging their fitness as best as possible.